Hey, good morning. Thank you all for being here. Just an extraordinary, compassionate group of people. And I also want to say a special welcome to over 2,000 people who have registered to watch virtually. I'm Mike Dowling. I'm the president and CEO of Northwell Health. And today is it's a very special meeting. In fact, it's more than just a meeting. It's a cause. We're here for a special reason, to do special things. We're here to learn, to share, to strengthen our commitment, to work together in unison, to hold hands as we march down the road of bending the curve of gun violence. Something that is extraordinarily important, as all of you here and those watching know very, very well. And you also know that it's extraordinarily complicated. It's a multifaceted issue, with all the components of it intertwined and interconnected. It's about the availability of guns. It's about the sale of guns. It's about the wrong people having guns. It's about the politics. But it's also about poverty. It's about mental health. It's about dependency. It's about neighborhoods that have been unattended. But that should not derail us. That should not slow us down. That, in fact, should incentivize us. Because if you look at the talent in this room, and many of you having your unique experiences, we've heard some of those last night and this morning. So many here have unique personal experiences. You've seen the result, you've observed the result, you've seen it in the neighborhood, and you've seen it personally. Complicated, yes. But we can handle complication, because we're better than it. We're bigger than the issue. We're stronger than the issue. And just as an introduction like this, there are many things you can talk about. So what I decided to do is just mention three things. High-level, generic things that I think are important. Because during the course of the day, with the various workshops and panels, etc., you're going to go into extraordinary detail on specific issues. Issues that we will all learn from, and I'm hoping all of us will leave here this afternoon with more knowledge, improved strategies that we can take back to implement in our respective arenas. So the three issues are the following. Number one is for us all, each and every one of us, to rethink and reimagine the obligation and the responsibility of leadership. What is leadership? Especially for those of us in healthcare, especially for CEOs of hospitals and health systems all over the country. What is it we're all about? Who are we? What do we stand for? What do we believe in? Leadership is about inspiration. It's about leading, not following. It's about education. It's about increasing awareness. It's about going into those arenas that others fear to go into. It's about taking positions that can be troublesome, maybe even dangerous. But that's what leadership does. Leadership creates other leaders. Many are involved in this, but many are not. Our job is to get those that are not to be involved, to reach out, to get people who may be fearful for whatever reason to get involved in this issue, for us to inspire them that this is health. This is a public health issue. If you are in the health arena, you've got to be playing in this arena. We that are directly involved in health care provision will never improve health in the community unless we go upstream to deal with these issues. Health is a lot more than the provision of medicine. It's not a lot more than just what happens in the diagnostic floors of a med-surg unit or what happens in the operating room unit. Oh, those are important, extraordinarily important, but it is more than this. Our responsibility is not only to look inside our organizations, but to look outside, to impact what goes on in the community at large, and to take on some difficult topics. So for those of you that know others that don't want to play in this space, our job is to make sure that they do, or that they feel bad about not doing so. Remember the quote by Ralph Waldo Emerson, who said, "Do not follow where the path may lead. Go instead where there is no path and leave a trail." That's what leaders do. That's what you are all doing. That's what our politicians should do. That's what the leader of other organizations not currently involved should do. And this is part of our responsibility, and our obligation is to get them to do it. The second point I want to mention is that we all have to acknowledge, and I think be proud of the fact that some progress has been made. You know, if you think of all of the new programs, the new initiatives, the new plans, the universal screening that's been going on in our emergency rooms, the increased awareness by people across the country and in our local communities. So progress has been made. Oh yeah, it's small. Doesn't seem like a lot, given what's happening on the other side. But remember, big issues and big successes are the result of the constellation of multiple small things. So don't diminish the small progresses. We all see them. We all see them each and every day. The fact that we're all here together in meetings like this is progress. The fact that each and every one of you in your own organizations are doing things you did not do before in this arena is progress. The fact that we now have 50 healthcare system CEOs from all over the United States that have been willing to put their signature on a commitment to focus on gun violence prevention and safety is progress. Because I remember 5 years ago when I reached out to many health systems across the country to suggest that this is a real public issue and they should put their signatures on a piece of paper, we got silence. I was told by many, too dangerous, It's the third rail. My board will be upset. I have got NRA members on my board. You don't understand the community I'm in. Yet this past Sunday, we put up on, we bought a full-page ad in the New York Times, signed by 50 CEOs, putting their signatures on the fact that they're interested in focusing on this issue. You see the ad. That's progress. So let's not diminish that which is being done and is happening each and every day, small as it may seem. Because I do know we're making a difference. And the last point I want to mention is that we all should be optimistic about the opportunity we have collectively to create a better future tomorrow. Remember, very few people want to follow a pessimist. People follow optimism, as difficult as it may appear, and as big as the hurdle seems to be. But we have the possibility and the opportunity to make tomorrow better than yesterday. For those of us in healthcare, just think of the seemingly intractable problems that we over history have solved, diminished, helped improve. You can name them. I don't need to name them for you. But we've made remarkable progress. We've tackled huge medical issues. I thought, as you all know, I'm from Ireland, in case anybody wasn't sure. I never ever thought that Ireland would ban smoking in public places. I thought there would be a revolution. It happened. I've mentioned to some of you, and you all know this very, very well, especially the people who have been around for a while, and I was reminded of it as I was in my car yesterday, and it was mentioned that Ralph Nader just turned 89. And I remember Ralph Nader way back when he started initially talking about seat belts in cars, about automobile accidents, an epidemic. And I remember everybody saying, nobody will have a seat belt in their car, nobody will buy them. Nobody will make cars with seat belt because it'll be too expensive. Forget about airbags, that's never going to happen. And look at it today. We must be continuously optimistic about the possibility of creating a better future. It's in our hands. We have to give oxygen to hope. We've got to make sure our younger populations around us and our kids believe, and believe firmly that because of us, tomorrow will be better. What other kind of a legacy do you want to leave? I know that at some point in the future, this tide will turn. We will overcome, and people will look back and say, thank you guys, those of you that were here before, for maintaining your commitment to making sure we have a better life today. That's what we want our kids to say. That's what we want our grandkids to say. You know, Angela Duckworth basically said at one time, she said, you know, enthusiasm is common, but endurance is rare. But we're a rare group. It's a long-term project. Won't happen quickly. But with a collective talent like this, and the others that we're going to join, that we're going to force to join this, or inspire to join this, we will make a difference. If we believe, others will believe. Those who are strengthening the opposing view will continue to do so. But we're on the right side of the issue. We have to have a vision that at one day, when our kids walk the street, they should not be fearful of being shot by a gun. It's possible. So let's be proud, committed, compassionate, dedicated, fearless, and optimistic. Thank you very much, and welcome.